So coming back to your question, whatever the cause might be, whether it's unwanted pregnancy or whether the duration between two kids are less, or whether it harms the health of the mother or the baby, or even she's not used the contraception and landed up with a pregnancy, whatever the cause might be. My role as a doctor out there is to not judge the woman or judge the girl for that. I have to do my work.
Hi everyone, welcome to Sisterhood. Today we're talking about abortions and demystifying the entire process around them in India. We plan to talk about three things. One, who can get an abortion? Two, how do you get one? And three, the mental and physical impact of such a procedure. With us, we have today Dr. Sujit Ash, who is a senior OBGYN consultant with a specialization in laparoscopy, contraception, and medical termination. Dr. Ash, please introduce yourself.
Hello everyone, I'm Dr. Ash Sujit. I'm a practicing gynaecologist attached to a hospital at Bombay, and my forte or whatever I talk about is about women's health, women's rights. Yes, Sankalp added a lot of things for me. Maybe that's secondary, but primarily important is women's health and whatever we can do to make it better.
So, Dr. Ash, for today, we want to focus on the procedure of abortions in India, which is one of your specializations. So, just to begin very directly, who can get an abortion in India?
Any girl, any woman who wants to get an abortion can get an abortion done. There are certain laws which come into play. We have the POSCO Act, which prevents a girl less than 16 from getting an abortion done before an FIR is filed in. But apart from that, any girl comes in and tells me that I don't want to continue with the pregnancy can ideally get a termination done till 20 to 24 weeks of gestation or pregnancy, as they call it. There have been changes which have been made in the MPP Act, what we call as a Medical Termination of Pregnancy Act, and currently it has been made better. So with that, we can, any girl who is still around 6 months, that is 24 weeks of pregnancy, can ask for termination for whichever reason which are enlisted in that. And the doctor has to oblige and give her different solutions which he or she can provide in the best will of the patient.
Got it. So, just to be clear, here do you need to cite any reasons like any medical risk, any mental health reasons?
So, ideally, we have few criteria under which you can get an abortion done. Yes, eventually, if you tell us that I just want to get an abortion done, we have different things that we have to fill into. But then the criteria which include are something which is dangerous for the health of the mother, or something which will eventually complicate the condition of the newborn, or if the act of pregnancy is because of any violence or any rape. Or if you can just tell me, like, this is because of contraceptive failure, that you've not used the proper contraception, or the contraceptive, whatever you've used has failed. Depending upon whichever criteria this fills in, we can put in the mark in that box which we get in the form, and very well go ahead with the procedure of abortion.
Got so up to 20 weeks, you need to give a reason, but there's no restriction on what reason allows you to get an abortion. And I heard that between 20 to 24 weeks, there's more stricter criteria.
Stricter, basically, you have to prove that this pregnancy won't be beneficial for the mother or the baby, or it is because of some other act. After 24 weeks, also, there are specialized conditions where we are doing abortions, but then the court of law comes in, and then there are a lot of questions that everyone has to answer, not just the doctor, but also the patient or any family members have to get it, and they answer for it. And it might be possible, but it's a bit of a challenge. But till 24 weeks now, currently, it's possible.
And do you need the approval of either your husband or any family member, assuming you're married?
Not ideally. We always taken a signature of the witness. Or if something, see, whenever you come for a surgery, there are two signatures which are required. One is the patient, one is the relative or the husband or the next of, whichever thing is applicable. It's wiser to get it done because at least you can document it in the paper. But otherwise, abortion just requires the woman to come in with a witness or with a contact detail person, and you can get an abortion done.
Could you talk a little bit about in your practice, like what are the common reasons why people are getting an abortion?
Unwanted.
Well, the reason I ask this question, there's always this perception about abortion that people will start getting careless and they start getting it because they were not careful with contraception.
Okay, so when you have to get an abortion, it is always an act of shame which is put onto the girl or the woman, but no one from the male point of view will take any consideration or take a part in that entire activity. So for a girl to reach out to you asking for an abortion, whichever way or whichever mode it might be, we usually agree on the abortion part as doctors and we give whatever is beneficial for her. So coming back to your question, whatever the cause might be, whether it's unwanted pregnancy or whether the duration between two kids are less or whether it harms the health of the mother or the baby or even she's not used the contraception and landed up with a pregnancy, whatever the cause might be. My role as a doctor is not judge the woman or judge the girl for that. I have to do my work, which is terminate the pregnancy, which can be done either medically or surgically depending upon weeks of pregnancy and give the best outcome to them so that this does affect the mental and the emotional well-being of a woman also. It's not an easy procedure to get it done. But then not just the medical point I can do, finish it up. We have to talk to her about different things. Maybe talk to her about contraception, maybe talk to her about safe sex practices. But that situation when someone is coming to me with a will to terminate a pregnancy, that's not the time when I'll be talking about contraception. That's not the time when I'll be talking about safe sex practices because then you will be bombarding her with information which will put her in guilt, which will help her, like put her to doubt herself.
Just very bluntly, how do you go about getting a termination?
Most of the times we get a woman coming to us saying that her urine pregnancy test is positive. So urine pregnancy test becomes positive at least maybe a week after you miss your period, not immediately at times. Once you tell me that the urine pregnancy test is positive, there are two of few important things that I ask for. The most important thing is always get an ultrasound done because that the pregnancy can be anywhere. It can be in the uterus, it can be in the tubes also. So if I do a medical management for the termination of pregnancy and if it is in the tube, that medical management won't be affected. And she might land up with something which is called an ectopic pregnancy, which is pregnancy elsewhere apart from the uterus, and that might be life-threatening. So these are basic practices that we follow. We teach our junior doctors also that always get an ultrasound done before planning any termination. Get few investigations if you want to. Maybe a basic hemoglobin because the girl or the woman will be bleeding. So always keep a track of the hemoglobin so that that is not an issue. So investigation-wise, ultrasound and maybe a hemoglobin level, that is something which will be mandatory. Depending upon how many weeks of pregnancy, we always calculate pregnancy in weeks and not in months, like how everyone does it. So depending upon how many weeks of pregnancy she is, usually we have a tendency of aborting anyone by 7 weeks by medicines. So the girl will take a pill and after 48 hours, we give her the pill once again, a different kind of pill, and that can lead to termination within 6 to 8 hours, wherein she'll pass chunks of blood with the pregnancy, and mostly it's over. I usually, as a practice, ask them to repeat an ultrasound after 2 weeks so that I see that everything is clear in the cavity. Okay, so that's usually till around 7 weeks of pregnancy. After that, if I find that there's some pregnancy which is continuing till later on, at least till 12 weeks, then we ask for something which is called as a suction evacuation or manual vacuum aspiration, which in layman term is called theli saaf karne wala procedure. So we put in a cannula and just clean the cavity out because their medical management can fail. The pregnancy might not be separating even after giving the medicines. So we do the curating process or cleaning process with different techniques, whatever the doctor prefers, and that is done. After 12, 13, it becomes difficult for me to do a suction evacuation also because the baby starts growing, so the baby starts having bones which are spiked. So that might penetrate inside the cavity of the uterus. So we don't do a suction evacuation. Then usually the process is like a mini labor. we have to give multiple drugs which will cause the cervix to dilate, which will cause the uterus to contract, and then the small fetus or the baby embryo comes out from the vagina. So depending upon which weeks I'm tackling, my plan of management becomes different.
And how much does this entire thing cost?
So depending upon where the woman reaches out to, the cost can vary. MTPs are done at specifically MTP recognized centers, so you can't just go anywhere and get an MTP done. So it can be done at a grassroots level also if the center is certified, or it can be done at a corporate hospital also, or a government hospital also. Depending upon where she reaches out, it can be ranging from anywhere between 5,000 to even 50,000, depending upon again whether we are doing it medically or whether we are doing it surgically. So all these aspects can vary depending upon which tier of city you're living in, which hospital are you reaching out to, who the doctor is. But usually it's somewhere between around, at a local level, it could be around 2,000 to 5,000 rupees.
And you mentioned that these terminations need to be done at special MTP certified centers. Is there enough number of centers in India?
Sadly, no. But then what we have done is in our degrees, when we get educated for our degrees or qualifications, we are taught enough so that we can do it. We do the MTPs properly, and that also works in. Your degree itself is validated to do MTPs, but then you have to be a little more careful because you can't be going voraciously and doing MTPs left in, out, and center. So understand the complication, understand the scenarios, get the investigation done properly, and then any gynae can do MTP. That's not an issue. But then MTPs can be life-threatening, and it shouldn't be done at a place which is not having a proper gynae, because then you can land up with unsafe abortions.
Okay. And how safe are abortions? Maybe if you compare it to a pregnancy.
It is a pregnancy eventually. It can be done very easily. There are a few things that we have to make sure that things are manipulated or understood for the woman. Manipulated won't be a good word, so we can. There are things that a woman needs to understand about the procedure, and it's hardly a daycare thing at times. The girl or woman comes in the morning, and by evening, once the procedure is done, she can go back home also. It's not something which is extensively life-threatening. Yes, I have seen in my practice criminal abortions where the patient has been brought in from some other place. That is difficult to manage because it can lead to sepsis or a generalized infection, or it might lead to damage of the uterus or the private parts. That becomes difficult to treat. That is unsafe. But in general, whatever we follow on with the dictum of the law, and if we understand the procedures properly with the weeks of pregnancy, it's completely and absolutely safe.
I guess for me, the question stems from the point that, if someone gets multiple abortions, or if someone is thinking of abortion as, a safety net, what are the risks that they should keep in mind?
Physical health, if the abortions are done correctly, again, I'll reiterate the point, is we as doctors know how much we need to cure it and we shouldn't be growing vigorously. Otherwise, you might damage the walls of the uterus or you might perforate the uterus. So all these things come with experience, come with from a good gynae. So physically, the damage part is not very dangerous or not very worrisome. But then one abortion can mess up also if it's complicated, if you perforate the uterus or if you damage any local structure when you're doing the procedure. So those things can happen. Emotionally, it can be challenging at times for anyone. Even the partner also, it might be challenging. That's a different ballgame altogether. You need to understand that if you've come to me for abortion, that is a secondary issue which I will tackle. But primarily, my tackling is the unwanted pregnancy for the time being. Emotionally, if you're going through it again and again and again and again, I have to think of some mode of contraception which will benefit from you. So these are the ways you have to tackle. So I can't be just blaming it or putting the entire liability on a girl or a woman for that issue. Maybe talk to everyone around it, the partner or anyone, and then we talk about the emotional aspects in general. There is a way that abortion is always considered to be a taboo. It's something which is considered to be bad. But it's your right. You can ask for it. You need a termination. You go ahead with it. If you have some issue, if you have a gallbladder stone, if you have some fracture, you'll come to a doctor and the doctor has to treat you, right? So why is there a guilt or why is there a doubt whenever it comes to a termination of pregnancy? It shouldn't be there, right?
Like, do you address any of those points as part of your practice, or are there specialized people doing this?
I do it. Because what happens is if I don't address, I can't be waiting for them to reach out to someone else. Or I don't know who else will talk about it. My reason why I talk to everyone about this is because I don't know or I don't understand, or I don't think about who else will talk about this to anyone else. I'm in front of you, so I'll be talking to you about everything. Okay, maybe not just like we discussed, maybe not just about abortions. I'll talk to you about contraceptive practices. I'll talk to you about menstrual hygiene. I'll talk to you about contraceptive needs or sexual health awareness, everything in that patient, but not right at that moment. It becomes sometimes overwhelming or overburdening of information. So you have to give it time. You have to let the girl come back after the recovery, maybe after a week or so when she's feeling better and things are fine. That's the time when you talk about it. So I do all the talking with them. There are people who can ask for more emotional support, so you can refer them to a psychologist or someone else whom they are comfortable with. But in my practice, I felt that they open up to you. The reason she came up to me is because she trusted me and she could talk to me about these things. So maybe that gives me that leverage that I'll also talk to her and make sure that it's better in the future for.
Got it. And does having an abortion or termination, does it in any way affect your chances of having a child later?
No, it doesn't. Any abortion doesn't usually lead to difficult chances in pregnancy later on in life, unless and until it depends on where the abortion is or who is doing it. So I'll again give you a basic example. Sometimes what happens is we have had cases where someone has got an abortion done at some area where they curated the cavity vigorously. So they damaged the lining of the uterus. So what happens when you damage the lining of the uterus in the process, the uterus linings stick to each other. So then the cavity is not that distended, or the bleeding during periods reduces, or that can lead to decreased fertility. So yes, in such situation it can happen. But if an abortion is happening with under supervision by a good doctor, there are no reasons why this should lead to any decreased chances of pregnancy later on in life.
Okay, understood. I think those were most of the questions that I wanted to talk about. Anything else that you would like to highlight for the viewer?
If you want a statistic, like in India, we have around 15.6 million abortions in a year. Okay, that's a huge number. And when you think about it, 1 in 7 pregnancies are unwanted. And of that, that is again a lot of no. And of that, around 67% of abortions that happen in India are unsafe.
Oh, wow.
Because when I am talking to you or you're talking to me, we are thinking about the metro cities. You're in Bangalore, I'm in Bombay. Yes, even in Bangalore and Bombay, girls or women are getting unsafe abortions. And we being from the metro cities, and even if unsafe abortions happen in Europe, in the village areas and other cities, you can't even fathom the extent at which unsafe abortions are being practiced because of different reasons. But then most of the time, it's just hiding the fact of anyone being pregnant. See, per se, sex itself is a taboo. We all know that sex will lead to pregnancy. But even for married couples, if they tend to have babies very quickly, they also are somehow looked or questioned upon. So they also don't want that. I understand it's because of financial constraints or something, but sometimes they just land up with a pregnancy and they don't want to disclose it immediately after the first baby is born. They want to get a termination done. So they want to hide the fact. They'll rush into some small center or local center and get the termination done by any doctor. That I'm just telling you about married couples. Unmarried couples or flings, they having abortion is self-explanatory. But those are the taboos, and then it's just hidden. We don't want to talk about it, and then complications add up, risk add up, and then it might affect the health of the woman and the future pregnancy. So it's like a cycle which continues.
Do you maybe a bit of a personal question. As a doctor practicing terminations in Bombay, have you ever found it challenging to be a part of this practice?
For me, it's not challenging. This is something I find it challenging for the girls or the women because they are unaware. Because you see everyone nowadays talking about cervical cancer, everyone talking about breast cancers. I have manuals out here which are put up for cervical cancers, pap smears, and everything. But nobody goes out and tells that I do abortions for you. Because even as a doctor, someone was like, ये तो abortion करता है and ये वही करता है. Like, they need it. And it's a part and parcel of what I learn, what I practice. So it's not something I take it as a challenging thing or something which I take it as a downgrading myself. I'm a doctor. I do whatever I can. Like I told you, my thing is women's health is important. Her rights are important. So if she asks for an abortion, she will get it. You're asking me about mental health of the woman when she's getting an abortion. Imagine if someone lands up with a pregnancy where the baby has to suffer his entire life, her entire life. And then you have to continue with that thing lifelong. Seeing that baby suffer in front of your eyes for the rest of his or her life for the mother, that's an even more mental health thing, which we don't think about. Abortion is any woman's right. So if you want an abortion, ask for it. But more importantly, understand more about the contraceptive needs and sexual health. Learn about safe sex practices so that we can reduce abortion rates in total. But then for the time being, what you need to know is that abortions can be safe, they can be done easily, and it should be better for your own reproductive health also. That's all from me, Dr. Ash. To the viewers who liked this conversation, Dr. Ash has a podcast called Guy from Gynaec. I'll link it down in the video below. Please do go and check it out.